Okay, so we continue the topic nervous system. We were discussing the nervous system and now we talk about the neuroglia. Okay, and you can definitely expect a short note on this neuroglia. Alright, so what are these neuroglia? I told you in the beginning itself that these are the supporting cells of the nervous system. These are the supporting cells of the nervous system. Okay, and these neuroglia cells are also simply known as glia. Okay, or I can say them glia. Okay, now let us understand the functions of these neuroglial cells, and that is very important if you get a short note or a viva question regarding the same. Okay. So number one, they support and help in structural maintenance of the nervous tissue. Support and structural maintenance of the nervous tissue. Okay, this is also a topic for viva. Then it helps in insulation for nerve conduction. Number 3, what is that? Nutrient supply to neurons. Nutrient supply to neurons. I hope it is very well understandable. It is very straightforward. Number 4, we have waste removal. Number 5, we have immune defense and phagocytosis. Immune defense and phagocytosis. Number 6, we have the regulation of extracellular environment. Regulation of extracellular, okay, extracellular environment. Number 7, modulation of synaptic activity. Modulation of synaptic activity. Okay. I hope you are finding these classes useful, wherein I am writing everything down for you so that you can make good notes. Okay, I am using the application Good Notes. Okay, so having understood the functions, now let us move further to understand the how the neuroglia can be divided into, okay, or you can say groups basically. So neuroglia can be grouped as into 2 categories. Okay, this is very important as for MCQ also and viva, so please pay attention now. Number 1, and you tend to confuse regarding this multiple times. Number 1, that is the central neuroglia. Then you can expect the number 2 would be the peripheral neuroglia. Okay, so central, that is neuroglia of the central nervous system. Peripheral, the neuroglia of the peripheral nervous system. Okay, now talking about the central first. This central, they are again the supporting cells of the central nervous system. Now the central neuroglia are further of 4 types. Okay, so let us see them. Let me rather extend it, just wait. Okay, so further the central neuroglia is of 4 types. Number 1, that is astrocytes. Astrocytes. Number 2, oligodendrocytes. Number 3, we have ependymal cells. These are very important cells we will discuss in neuroanatomy again and again. You will see the names in MCQ also. Then the last but not the least, microglia. Sometimes you can expect a viva question on microglia. Okay. Then talking about each one of them separately. Okay. So like you should be understanding the basic thing where these cells are present and what are their functions. Okay. And also you have peripheral neuroglia. Okay. Now peripheral neuroglia further have two kind of cells. What are these? Let us see. We have two types. Number 1, that is the Schwann cells. Please see the spellings while writing. Schwann cells. Okay. And then you have satellite cells. Okay. So now let us discuss them one by one to understand the how these are important for the body and where they are present. That is also very important. Okay. So now let us come to the first category that is the astrocytes. Okay. Now see, neuroglia, I told you, they are supporting the embryonic or developing neurons, as well as they provide the physical support after development. And radial glial cells, they direct the migration of the neurons during the development. Now astrocytes, basically, as you can imagine the name, astrocytes, they are star shaped cells. Okay. So you can write, very important, they are the star shaped cells. Okay. And also they are the largest neuroglia. Okay. So that means it makes it's very important for the MCQs as well as viva. Okay. And they have numerous processes. Can you see this cell? And it has numerous processes. Okay, just like a star. Okay. So just like a star, see there it has numerous processes. That is why we are calling it as the astrocytes. Okay. And these astrocytes are further of two types. Okay. Interestingly, they further can be divided into two types. Okay. The first one, that is the fibrous astrocyte. Number 2, we have the protoplasmic. Fibrous and protoplasmic astrocytes. Okay. So now fibrous, as you can see in this photo also, let me highlight. Now fibrous one. Okay. This one, they are fewer and they have thin processes and they are mostly found in the white matter of the CNS. Okay. So these are the very characteristic features. Fibrous, it is having fewer and thin processes. Fewer and thin processes, you can very well see in the photo also. I hope you can see this thin and this thick comparatively. Okay. Fewer and thin processes. Okay. Mostly found in the white matter. Present in the white matter of CNS. we are talking about the CNS. Okay, you will get the PDF, don't worry, I am writing behind my back. Okay, so don't worry. Then protoplasmic. Protoplasmic is again same concept. It is the difference, contrasting difference here, as you can see. Protoplasmic, they are numerous comparatively. Okay, I am writing it here. They are numerous, short, thick, branching cytoplasmic processes. Branching cytoplasmic processes. Okay, and they are found in, or I can say present in, gray matter, okay, of CNS. All right. So what are the functions? Now there are a lot of functions, like they provide physical support to the neurons, they maintain a favorable metabolic environment for the neurons by removing the neurotransmitter from the synapses. They also help to maintain the blood-brain barrier. Please write this one, this is very important point. The astrocytes, they help to maintain the blood-brain barrier. Don't bother about this topic right now, it will be taught to you in detail in the neuroanatomy section in the end of the year. Okay, so don't worry at all. And then you have something known as gliosis. Okay, what is that? So proliferation of the astrocytes to heal the damaged zones of the nervous tissue, that is known as gliosis. And what are the astrocytes actually doing? They maintain the potassium ion concentration in the extracellular spaces of the brain and spinal cord by potassium spatial buffering. Okay, and then if you talk about the clinical aspect of this, if I were to write the clinical, I am keeping one slide for each cell so that there is not much clustering in the notes. Okay, so the fibrous astrocytoma, this accounts for 80% of brain tumors in adults. Okay, I even recently had a relative also who was suffering from the same, and same, you don't need to be a neurosurgeon to guide the patient. You obviously he will be performing the surgery and prognosis and everything, but at least for your relative, if you are not a specialist in that field, at least if you have an idea what the cell is, what the thing is, you can explain to the patient that what is it, a serious problem or is it not, is it very important to get it done. You have to see the age of the individual also, there are a lot of factors. Okay, so this fibrous astrocytoma is actually 80% of the brain tumors in adults. So next time if you hear anyone talking about the brain tumor, try to dig in the history and try to ask or see the reports what kind of brain tumor. Okay, like in the movies also you see brain tumor. Brain tumor can be any cell tumor, right? Any place there can be a tumors, so you have to check what is that. Then we come on to the next, that is the oligodendrocytes. Oligodendrocytes. You might be wondering why I have kept this neuroglia on the side in the heading, just to maintain the integrity of the topic so that you remember it is neuroglia which we are talking about. It's nothing that separate entities, they are all a neuroglia only. So now you can imagine if you get a short note on neuroglia, you have a lot of things to write. Now this oligodendrocytes, they are small round cells. You can see in the photo also, they are small round cells and they have very few cytoplasmic processes and have few cytoplasmic processes. Now you might be wondering why few cytoplasmic processes, because of the same term. So because oligo, you should be knowing this because you will get this oligo word multiple times. In obs and gynae also it comes into picture. Oligo is equal to scanty. Okay, this is in Greek. So that is the reason why we are having this few. So that is with the name which is given. So now you can see the elongated nucleus, very fine processes and very few as compared to the one. You can see 1, 2, 3, 4, 5, 6. That's it. Not multiple, too many are not there. These are the oligodendrocytes. Alright. So now let us see what are the functions. Function of oligodendrocytes, very important. Please mark it as super duper important question. What is the function? It produces myelin sheath. Produces myelin sheath. I hope you have read this myelin sheath in NCERT also, right? Myelin sheath in the CNS. Okay, it produces myelin sheath in the CNS. And so one oligodendrocyte, it myelinates many adjacent axons or sometimes the same axons at different places. Okay, and non-myelinated neurons, they are not enclosed by processes of oligodendrocytes in the CNS. Okay, so you have to remember this. It produces myelin sheath in the CNS. Okay, so that's about the astrocyte and oligodendrocytes. Then we come on to third category, that is ependymal cells. Ependymal cells. Please see the spellings when you write correctly. In the exams, your marks will be cut if you write the incorrect spellings. Okay. So the cavities of the central nervous system, like they are lined by epithelium like ependymal cells, which is very important topic. Again, it will come in the picture when you will discuss the neuroanatomy. Okay, the brain. So there is a ventricular system of the brain, that is the cavities in the nervous system, which we will discuss in quite detail, and there are short notes also. Those cavities are having some an lining epithelium kind of thing, that is the ependymal cells. Now you might be wondering why these ependymal cells are needed. They are very important because they are the one which help to produce the CSF. Okay, so please write ependymal cells. They can be they can be cuboidal to columnar, in shape, and they are arranged in a single layer. Okay, so there are three types of ependymal cells. Three types of ependymal cells. Okay, what are these? Number one, very important for MCQ, ependymocytes. Okay, these are the cells only. Number two, we have the choroid epithelial cells. And number three, we have the tenicytes. We don't need to go into detail about these. Okay, just remember the names, that is more than sufficient. Okay, then talking about the functions. As I told you, functions, number one, they help in exchange of substances. Between the brain and the CSF. Now you might be wondering which barrier is this? So this is at the blood CSF barrier. Okay, again we will study about this. Oh sorry, I'm so sorry. And we will also be studying about this in detail again in the neuroanatomy. Okay, at the brain CSF barrier. Okay, then number 2, we have the choroid plexus. We will see the choroid plexus in detail. This secretes the CSF. Okay, so you can see this image showing the CSF here. Okay, and this is the brain tissue, and these are the ependymal cells which are lining this. It appears to be a lining epithelium kind of thing. Then we have the microglia cells. Okay, then we have microglia. As you may be mentioning micro, so these are the smallest. These are smallest neuroglial cells. You remember the largest, right? Astrocytes. Smallest are the microglia. And the functions. Function of this microglia. They are the phagocytic cells. They are the phagocytic cells, and they proliferate specifically in the nervous tissue, injuries and diseases. And microglia, they form a very important part of the mononuclear phagocytic system in the CNS. Okay, so they are the function is a phagocytic cell. Just remember this much, that is more than sufficient. Next we come on to the peripheral neuroglia. Now in the peripheral neuroglia, this is what we are talking about, peripheral neuroglia. Okay, and in peripheral neuroglia we have two cells, I told you, Schwann cells and satellite cells. Okay, so now Schwann cells, they are, let us talk about them one by one. Yeah, so number 1, that is Schwann cells. Okay, so we are talking about this one. So this Schwann cells, they are also referred to as, they are also known as neurolemmocytes. Neurolemmocytes. This can be asked in MCQ, please be aware. And they are present only in the peripheral nervous system. Present only in the peripheral nervous system. The function, as you can imagine, we have already discussed. Function to produce the myelin. Produce myelin in the peripheral nervous system. Okay, so you can see this photograph showing the Schwann cells. Okay, this is the myelin which is surrounding them. This is the axon. Okay, so these are the Schwann cells. Then you have the satellite cells. Now what are these satellite cells? Number 2 category. Now these satellite cells, in the ganglia, the collection of the neuronal cell bodies outside the CNS, the neuronal bodies are surrounded by a layer of flat cuboidal cells, and these are known as satellite cells. Okay, so these are flat cuboidal cells. Okay, this satellite cells, the importance of this, they give passage to the nerve cell processes. Okay, and in sensory ganglia, the satellite cell capsule is nearly complete as the sensory neurons do not synapse in the ganglia. You will understand these concepts more throughout your anatomy journey, but I'm just telling you brief. Don't need to write these things, just understand them. Maybe you can revisit this video again when you read these things in the nervous system later on, maybe in physiology also. Then in the autonomic ganglia, the satellite cell capsule is not complete, and because the autonomic neurons, they have synapses in the ganglion. So what is the function of these satellite cells? The function is protection and support the ganglionic neurons Okay. Next we come on to the topic which you might have already covered in the physiology, but it's given in the general anatomy nervous system. So I'm just touching up what is given in your textbooks of anatomy. Obviously in detailed synapse you will understand better in physiology. You have a separate chapter of synapse. Okay. So what is a synapse? Synapse actually is a cultural fest program also in MAMC, if you are aware. Okay. So synapse. Now this synapse is what? The neurons, they convey the messages to another cell, or I can say neuron, that is the effector cell, through a synapse. So synapse is essentially what? It is a junction between the neurons. It is a junction between neurons. Okay, simply put, like to understand. Then if we talk about the morphological classification, as you can see in this flow chart, you have exodendritic, exosomatic, exoaxonal, dendroaxonic, dendrodendritic, somatosomatic, somatodendritic. So these are the various morphological types of the synapse. Okay, and you can see the same in this photograph here. Okay, so you can see, for example, if I take this up, dendrodendritic. Okay, dendrodendritic, so means presynaptic we have dendrite, and post synapse we have again dendrite. Okay, so dendrites with the junction with the dendrites. Okay, similarly somatodendritic, that is soma, cell body, and the dendritic. Then dendroaxonic. Okay, then somatosomatic, then exodendritic, then exoaxonal. So same terminology, cyton, the platform which we are studying upon. Okay, this is cell. So we have understood the parts already, we have discussed in the previous class. So just remember those and just connect them, how they are forming the junctions. Next, classification of synapse based on the mode of transmission, and this is asked in the viva. Okay. Now mode of transmission. So number one, we have the chemical synapse, then we have the electrical synapse. Okay, it's very easy. It requires the neurotransmitter, it does not require. So chemical requires some neurotransmitter, chemical. Okay, gap junctions are absent in this, very important, please remember. Gap junctions absent, gap junctions present. Requires neurotransmitter, does not require neurotransmitter. Okay, simple. Then we come on to the structure of chemical synapse. Okay, so see in this photograph, if you see carefully, this you will study in quite detail in the physiology class. So there are some components of the chemical synapse which you have to remember. Okay, so structure of chemical synapse, components we are discussing now, which is asked in the exam. Okay, so number one, we have the presynaptic element, or I can say presynaptic knob. Okay, presynaptic element or presynaptic knob. This is the number one. Sorry, this is the number one component of this chemical synapse. So this presynaptic knob, this is the part of the presynaptic neuron which releases the neurotransmitter, and this presynaptic element stores the neurotransmitter in the synaptic vesicles, as you can see in this photograph also. Okay, then you have number two component, major component, that is the synaptic cleft. Okay, then you have the synaptic cleft. So this cleft is a narrow gap, Okay, this narrow gap can vary from 20 to 30 nanometer, okay, between the presynaptic and the postsynaptic neurons. Neurotransmitter need to cross the synaptic cleft. Simple. Okay, you can see the neurotransmitter crossing simply. Then you have third very important component, that is a postsynaptic membrane or the process. Number 3, that is postsynaptic membrane, or I can say process. Okay. Now this is a membrane, the membrane of the postsynaptic neuron that has receptors for the neurotransmitters. Okay. So now, having understood so many neurotransmitters again and again, let us understand what are these neurotransmitters, and you can very well expect a short note on the topic neurotransmitters. Okay, these are very famous short notes in any university exam in the general anatomy paper which you get in the initial phases. So please prepare them. Okay, so I'm just telling you many things, you can club them up with the physiology topic and you can form a very good short note. Now these neurotransmitters, they are the substances which are released from the presynaptic neurons that traverse the synaptic cleft to reach the postsynaptic membrane. So I have summarized the entire story in one statement. They may depolarize, or I can say activate, or hyperpolarize, that is inhibit the postsynaptic membrane. So this is a very important concept. Please remember, neurotransmitter can depolarize, that means activate, or it can hyperpolarize, inhibit the postsynaptic membrane. Okay, so the neurotransmitter, they can be grouped into based on their chemical nature. Okay, so what are these? Number 1, we have acetylcholine, Number 2, we have amines. Now what are these amines? You get these kind of short notes basically. These amines, noradrenaline, adrenaline. Okay, these are very life saving drugs also. Then serotonin, then dopamine. We will study about dopamine also in neuroanatomy. Dopamine, then histamine, very important, histamine. Okay, number 3, that is amino acids. Which involves GABA. Okay, what is GABA? That is gamma aminobutyric acid. Butyric acid. Okay, then you have glycine, okay, glutamate and aspartate. Okay, then number 4 category, you have the neuropeptide. Now neuropeptide, it includes substance P, endorphins, then enkephalins. Okay, so neurotransmitters, they bind with receptors to produce their desired effects, as you will study in physiology. For example, acetylcholine, it binds with cholinergic receptors. Adrenaline, noradrenaline, they bind with adrenergic receptors. Okay, so that is something which you have to remember. Then so this acetylcholine, okay, this abbreviation you can use, acetylcholine, ACH. Okay, acetylcholine esterase immediately hydrolyzes the secreted acetylcholine into the acetic acid and the choline. This is the viva question which we will study in physiology and biochemistry. Okay, then talking about the applied, okay, which is my favorite part. So clinical. Now in clinical applied anatomy integration, that is number one condition which we have here, that is the myasthenia gravis. If you any of you guys are planning to do USMLE, so you can remember these clinicals side by side, because USMLE step 1 exam is all about clinical case scenarios. So you have to read through the big paragraphs, you have to practice those, and nothing but the concept remains the same. So don't miss studying the core textbooks of anatomy, physiology and biochemistry, because those have all the clinical boxes which you cannot skip. I see many students, I have been teaching so many places pan India, and I have seen the MBBS first year students, they resort to cut short practices by not studying the textbooks, and they are missing on many things. Even any textbooks which you have to refer, like Vishram Singh, B.T. Chaurasia, Yogesh Sir's book, any book if you refer, Gray's for that matter, Snell's, Keith L. Murray, all these textbooks, they have some clinical boxes, okay, clinical case scenarios. Do have a read about them side by side, because that will make you a very good doctor. Okay, otherwise you are studying everything as it is, but you don't remember anything. But clinical way you will remember better. So okay, so we have myasthenia gravis here. Myasthenia gravis, it's an autoimmune disease in which the antibodies, they destroy own acetylcholine receptors in the muscle fibers. Now this myasthenia gravis, it actually results in muscle weakness. Okay, that muscle weakness is very severe. Okay, it results in muscle weakness, fatigue. Okay, then also ptosis. That is, what is ptosis? It is drooping of upper eyelid. We will study that also in detail, don't worry. Then flaccid muscle paralysis. Okay, don't worry, again this will also come up in detail in physiology as well as medicine as well as neuroanatomy later on. Okay, so flaccid muscle paralysis. So just remember myasthenia gravis. Treatment, so you can imagine the treatment will be the anticholinesterase drugs. So for example, you will be hearing in the pharma prof, that is the neostigmine. Okay, neostigmine, which enhances the acetylcholine concentration, and hence it is useful in the treatment of myasthenia gravis. Okay, so this is about the neurotransmitters which you have to remember. Okay, then we come on to the next, that is the myelin sheath. Now formation of myelin sheath is again something which can be asked to in the short note form. So just see this diagram to remember the same things which we are discussing. Now what is myelin sheath? It's an insulating sheath surrounding the axon of the myelinated nerve cells. Okay, myelin is produced by oligodendrocytes in CNS. Let me write this. This is the most important point. It is produced by oligodendrocytes in CNS. All right, and Schwann cells in PNS, that is peripheral nervous system. So this is the single most viva question which you have to remember. Okay, don't forget, viva, MCQ, everywhere this is being asked. Okay, all right, then myelin consists of, what is this myelin sheath consisting of? Myelin sheath contains of lipids which is actually 80% of myelin. Okay, then proteins and water. Okay, so now coming on to the formation of the myelin sheath. Now in the process of myelination, as you can see in this photograph also, this is the axon. Okay, now what is happening here, let me zoom in, I hope you can see, right? So in the process of myelination, the axon initially lies in the groove of a Schwann cell. Okay, so you can see in the groove of a Schwann cell, this is a Schwann cell. Okay, in this groove, that is the one which is present. The axon is initially lying in the groove. Now there is a sheet-like extension of the mesoaxon which surrounds the axon spirally in a spiral manner, and cytoplasm of the mesoaxon, it gets squeezed. This results in the formation of the myelin sheath, that is a lipid layer around the axon, as you can see the step number 2. So it is surrounding it. Now this is the mesoaxon which has been shown here. Okay, step number 3. Then outside the myelin sheath, thin layer of cytoplasm of the Schwann cell is present along with the surrounding cell membrane of the Schwann cells. Now this is known as neurilemma or neurilemmal sheath. Okay, so this is neurilemma, as you can see, neurilemma, or also known as neurilemmal sheath, simple. Now there is a concept regarding this which is asked in the MCQs. There is something known as, please write it separately and check the spellings, it is very tongue twister kind of thing. Schmidt, okay, Schmidt-Lantermann. Schmidt-Lantermann clefts. Okay, now what are these? See this photograph, you will understand. I have tried to fetch the best ones which I could. Okay, so these are the small pockets of the cytoplasm in the inner layers of the myelin sheath. It is asked in the viva also. If your viva is going good, especially in the histology and general anatomy, so they keep on asking these. So it's small pockets of cytoplasm, small pockets of cytoplasm in the inner layers of the myelin sheath. In the inner layers of myelin sheath. Okay, so usually the cytoplasm, it gets squeezed out of the myelin sheath during the wrapping of the mesoaxon around the axon. So non-myelinated axons, they are covered by Schwann cells in the PNS. Single Schwann cell is invaginated by multiple non-myelinated axons. Okay, so this is very important. So like for example, one Schwann cell which will be surrounding multiple non-myelinated nerve fibers. Okay, so that is something to remember. And the gap which you can see here, maybe you can appreciate here in scissors. Okay, so the gap between the segment of the myelin and between the adjacent Schwann cells, this gap is known as, what is this gap? That is the nodes of Renvier or insusura myelini. Okay, so let me come to the next photo. You can see here, these are the nodes of Renvier. Okay, this nodes of Renvier, also known as nodes of Renvier. You might have read this in NCERT also, right? Nodes of Renvier, and these nodes of Renvier, they are known as incisura myelini. You will read incisura somewhere else also. Later on, we will come to that also. Okay, so the nodes of Renvier. Now why I am talking about all this, because nodes of Renvier has been asked in the MCQs also. These nodes of Renvier, they increase the rate of nerve conduction. They increase the rate of nerve conduction by saltatory conduction. Okay, you might have read this word also earlier. And then there is something known as internode, which is a segment of the myelin sheath between the adjacent nodes of Ranvier. Thickness of the myelin sheath, it depends upon the axon diameter, okay, and not on the Schwann cell. A single Schwann cell, it can protect many non-myelinated axons, okay. Then we talk about the functions. Functions of the myelin sheath, okay. Now functions of the myelin sheath are very important again. Number one, that is protection and physical support. Protection and physical support to axons. Number two, that is insulation of axons. Insulation of axons. Number three, increases the nerve conduction. Increases the nerve conduction by saltatory conduction, which we just mentioned. Number four, that is neurolemmal sheath. Neurolemmal sheath. This plays a major role in the nerve regeneration. Plays a major role in nerve regeneration. Okay, so these are the main functions of the myelin sheath. Now talking about some clinical integration here again. Clinical integration. Okay. Okay. Clinical integration involves two entities. Okay. Number one, that is the enuresis. Rather, you remember the first one, that is enuresis. Okay. What is enuresis? It is bedwetting. Right? You are aware of this. It is observed in the first 3 to 6 years of life. It occurs up to the completion of the myelination of corticospinal tract fibers, which are controlling the emptying of the urinary bladder. So what is the embryological basis behind this? Okay, this is the clinical integration of this topic. Okay, so myelination begins before birth and it continues for a few years after birth. Enuresis is very normal in infants. One Schwann cell can produce a myelin sheath around a small segment of one axon. One oligodendrocyte can produce a myelin sheath around many axons. So that is a basic difference. Hence, the neurolemmal sheath is present only in the peripheral nervous system, that is the cell membrane of the Schwann cell, not in the CNS. As a single oligodendrocyte, it does not cover one axon. Okay, and because of the absence of the neurolemmal sheath in the CNS, the regeneration of the neuron, it is not possible in the CNS. Okay, so that is something to remember. Okay. The nerve regeneration, okay, which we have discussed. Now talking about the classification of the nerve fibers before I jump to that. Okay, all right, so classification of the nerve fibers. So based on the diameter of the nerve fibers, they can be grouped into 3 groups, that is group A, group B and group C. Now see, the group 1 is a highly myelinated fibers. Highly myelinated fibers. Number 2, that is thinly myelinated fibers. Okay, up to 3 micrometers thick. Okay, then we have non-myelinated fibers. Non-myelinated fibers. Okay, so these can be 0.2 to 1.5 micrometers thick. Okay, so that is the classification of the nerve fibers. Then coming on to the next, that is the conduction of the action potential. So again, this topic, conduction of the action potential, is something again which has been discussed in detail in the physiology, but I will be again touching up very basics here. So the ionic concentration within the neuron and the extracellular fluid, it creates a RMP, if you are aware, that is the resting membrane potential. Okay, so across the plasma membrane, at resting membrane potential, the neuronal plasma membrane, it is polarized. Resting membrane potential is always negative, that is it is minus 70 millivolts. Okay, the resting membrane potential is negative because of the high concentration of cations, that is sodium ions. Okay, so this is negative due to high cations, that is Na plus ions. Okay, outside the nerve fibers in the extracellular fluid which we are talking about. Then talking about the action potential. Now action potential is nothing but a sequential change in the membrane potential that develops on activation or stimulation of the nerve cell. It rises in the, there is a rise in the membrane potential which soon comes back to the resting membrane potential. Now this involves 2 phases. Okay, so you can see in this photo also, it involves 2 phases. Number 1, two phases. First one is the depolarization. Depolarization. Now depolarization involves increase in the membrane potential, that is increase in the membrane potential up to plus 40 millivolts. Okay, then we have number 2, that is repolarization. Repolarization. Now there is a decrease in or restoration of membrane potential. Okay, so you can see in the same photograph also, this is a node of the Renvier, that is active site. You can see solitary conduction has been shown. Again, physiology, you will study everything in detail in Guyton Ganon, everything is given very beautifully. And you can see continuous conduction, okay, exolemma. So there is depolarization and repolarization. Okay, so action potential is something which is generated at one point of the neuronal plasma membrane and it propagates across this membrane. The speed of conduction of action potential, it depends upon the myelination of the nerve fibers. The thickness of the myelin, it is directly proportional to the conduction of the action potential. So what is saltatory conduction, which is written here? What is this saltatory conduction? Saltare means to leap in Latin. Okay, so jumping conduction of action potential from one node of Renvier to other nodes of Renvier. In thick myelinated motor fibers like alpha fibers, the speed of conduction is very high, that is approximately 70 to 120 meters per second. Okay, so there is something known as nerve injuries. Now based on the severity of the damage, the nerve injuries can be further classified. Okay, okay, based on severity of damage. The nerve injuries, they are classified as number 1, that is, now please see the spelling, they are very tongue twisters again, neurotomesis. Okay, neurotomesis. Okay, neurotomesis. Then you have axonotomesis, axonot. Okay, axonotomesis. I will explain you what are these. Number 3, neuropraxia. Neuropraxia. Okay, so now see, neurotomesis. What happens? Both the axon and myelin sheath are damaged. Both axon and myelin sheath damaged. Okay, in axonotomesis, as the name suggests, only the axon is damaged. Only axon is damaged. Okay, so what happens? The myelin sheath is intact. Myelin sheath is intact. Okay, then neuropraxia. Okay, then you have neuropraxia. There both myelin and axon, both axon and myelin sheath, they are damaged? No, they are preserved. So please pay attention, that is the MCQ also they ask you. So nerve regeneration, it occurs in the peripheral nerve in case of neuropraxia and axonotomesis, but in case of neurotomesis, the nerve regeneration does not occur. Okay, so you can write this note. Nerve regeneration occurs in 2 and 3, not in 1. Okay, in case of neurotomesis, the nerve regeneration does not occur. Okay, then we come on to the short note which can be asked to you regarding the nerve regeneration and degeneration. Okay, so there are injury to the axon with the myelin sheath which can involve 2 events. Okay, so let me tabulate the major things which are in these 2 events. Okay, number 1, that is degeneration of the nerve fiber. Degeneration, and on this side let us write the regeneration. Okay, I hope it is visible, or maybe I can use a darker color. Just hold on. Okay, I think dark green is okay, right? So talking about this degeneration first. So degeneration, what is the definition? These are the changes that occur in the nerve cell following the injury. These include changes in the nerve cell body and changes in the nerve fiber. Okay, These are the degenerative changes. Now what are the changes which are actually happening? So you can write number 1, changes in the nerve fiber. Okay, what are these? Wallerian degeneration, I will show you in the photo also. In a while you will understand better. Okay, Wallerian degeneration. Okay, that is a change in the distal segment. It includes the disintegration of the myelin and degeneration of the nerve fibers. Then you have number 2, that is a degeneration of the proximal segment. Okay, which would be up to the nearest node of Renvier. So just remember Wallerian degeneration, that is the main keyword. Then number 2, changes in the nerve cell body. Okay, changes in the nerve cell body. Now what are these changes? Here you have, due to the loss of neural activity after injury, the cell body, it undergoes certain changes. Now what are these changes? Let me write. Number A, that is chromatolysis. Okay, that is disintegration of the Nissel's body. Number B, that is cell swelling. Okay, C would be nucleus shifts to an eccentric position. Nucleus shifts eccentric. Okay, so these are the changes in the nerve cell body which you have to remember. Okay, changes in the nerve fiber, which includes primarily the Wallerian degeneration. Okay, please remember this one, which is very important. Wallerian degeneration. Okay, now talking about the regeneration. Okay, regeneration includes certain events again. Okay, regeneration of nerve fiber is a very slow process. Okay, so this is slow. And it can begin after 2 weeks after the injury. Okay, then what is the different processes? I will show you in the photo also in a while. First let us write down number 1, that is process of regeneration, which involves the macrophages remove the debris of the degeneration by the phagocytosis. So first step would be phagocytosis. Okay, number 2, that is Schwann cell proliferation. Schwann cell proliferation. Okay, number 3, axonal growth. Number 4, we have elongation of the axon. Elongation of the axon. Number 5, we have a regeneration of myelin. Regeneration of myelin. Okay, so number 1, that is the process of regeneration. Okay, let me show you these photographs so you can appreciate. This is a normal neuron with the Nissel's granule, Schwann cell, axon, just to give you a good orientation. So this is the site of injury. Now see what is happening in these images. Okay, so what is happening? Number 1, the process of regeneration involves the macrophages, which are removing, the phagocytes are removing the debris. Okay, so that is by the phagocytosis. Then you have the Schwann cell proliferation, which I told you. What is happening? They are proliferating and filling the empty space created by the disintegration of the axon and the myelin. Then Schwann cells, they also fill the gap between the proximal and distal segments of the axon. So just see that they are filling it, basically filling the empty spaces. Okay. Axonal growth. Now see, axon fragments are formed here. So there are axonal sprouts. So axonal growth is happening. The ends of the axon, they give rise to multiple sprouts. They enter the endoneurial tube of the proliferating Schwann cells. So you can see in this photo very carefully. This is the step number 3. Then we have step number 4, that is elongation of the axon itself. So the elongation of the axon. So now this one of the axonal sprouts, it continues elongation under the guidance of the Schwann cells to reach the end organ. Okay. So what happens? There is a elongation of the axon. That is number 4. Then regeneration of the myelin. Surrounding Schwann cells, they will reform the myelin sheath to restore the function completely. So you can see the final picture. Again, normal neuron is shown. Okay. So that is a very simple understanding regarding the steps of the regeneration and what happens in the degeneration. So this is just purely viva and MCQ and short note kind of story which you have to remember. Then we have, before we begin the peripheral nerves, let me add a clinical integration. Clinical point, that is neuroma. What is this neuroma? It is a benign tumor. Okay. So sometimes if the distance between the cut ends of the nerve fiber, it is more, then the gap is filled with the fibrous tissue which contains growing axonal sprouts, and this mass forms the neuroma, and this is very painful. Okay. So remember, it is a benign tumor. Oh sorry, it's a benign tumor. Okay. You can read about it in more detail, although it's not required. You will study all these things in further prof exams. Okay. Next we come on to the peripheral nerves. Now peripheral nerves, they form a communication between the organs and the central nervous system, and they consist of 2 components. Okay. So peripheral nerves, it consists of 2 components. What are these? Number 1, that is somatic nerves. Number 2, autonomic, that is splanchnic or visceral. Splanchnic or visceral nerves. Okay. So peripheral nerves, it includes what all structures? The peripheral nerve, it includes number 1, that is 12 pairs of cranial nerves. We will read them in quite detail in the head and neck region. 12 pairs of cranial nerves. Number 2, we have 31 pairs of spinal nerves. 31 pairs of spinal nerves. And number 3, we have autonomic or splanchnic nerves. Autonomic or splanchnic nerves. Okay. These are the parasympathetic and sympathetic nerves. Okay. So peripheral nerves. Okay. This peripheral nerves, as you can see in this flowchart also, they contains the somatic or afferent sensory fibers which carries the sensory inputs from the skin, bones, muscles, joints to the CNS. It carries somatic efferent, that is the motor fibers, which carry the motor impulses to the skeletal muscles. Then visceral afferent, that is the sensory fibers which carry the input from the organ, blood vessels to the CNS. Then we have visceral efferent, that is motor, to carry the impulses from the CNS to the glands, smooth muscles of organs, blood vessels and cardiac muscles. Okay. So you can just remember this peripheral nerves. Okay, this maybe I can write it here so that you remember. Number 1, that is the somatic afferent. Afferent means the sensory. Okay, somatic afferent. Number 2, we have the somatic efferent. You will read this same concept in head and neck when we will discuss the cranial nerve columns. Okay, function columns. Then we have visceral. We have visceral afferent. And number 4, we have again visceral, but this time efferent. Okay, afferent is sensory and efferent is motor. Alright, so the bundle of the nerve fibers in the CNS, they are known as tracts. Okay, so now you can see this chart also to understand better. Okay, so peripheral nerve. So peripheral nerve consists of each nerve fiber which contains all these things: endoneurium, perineurium and epineurium. So again, a very important concept of peripheral nerves, the neuriums. Okay, so just remember the endoneurium, which surrounds the individual nerve fiber. It surrounds the nerve fascicles. So let me highlight them. Endoneurium, it is surrounding the individual nerve fibers. I will show you in the photo. Perineurium, it is surrounding the nerve fascicle. Lastly, epineurium, which surrounds the nerve bundles and the entire nerve itself. Okay, so these are the different neuriums which you have to remember. Okay, so the peripheral nerve, they are the collection of many fibers, nerve fibers, which are held together by the connective tissue only. Okay, so nerve fibers with the Schwann cells and basal lamina, this is the basic structural unit of the functional of the peripheral nerve. Okay, so let me show you this photograph and highlight these again, very important ones. Okay, we have used yellow for the epineurium, green for the perineurium and blue for the endoneurium. Okay, so these are the 3 ones which you have to focus upon. Okay, you can see this photograph, nodes of Renvier, internode, we discussed everything. So now see this photograph to understand. Endoneurium, it is consisting of loose connective tissue with the collagen fibrils, few fibroblasts, occasionally mast cells and macrophages. A group of nerve fiber which forms a nerve fascicle or a bundle. Each nerve fascicle is surrounded by a layer of specialized connective tissue which is known as perineurium. Okay, so now you see this is the endoneurium, then you have perineurium, green color shown here, and outside one you have the epineurium. Okay, so perineurium is made up of this perineurium. It is made up of flattened or squamous perineural cells. So they are connected to each other by the tight junctions, and hence there is something present as that is the blood nerve barrier. Okay, so there are so many barriers: blood brain barrier, blood testis barrier. Okay, this is the blood nerve barrier in your brain which will not prevent you, which will prevent you to study and remember so many different things. That is a barrier. Okay, it's a barrier to study. Okay, so remember these barriers. Then you have epineurium, which is surrounding the entire peripheral nerve. It contains the blood vessels which supply the nerve. So blood vessels, like you can see here, the blood vessels. This is the nerve fascicle. Okay, so blood vessels, like they are known as the vasa nervorum in this case. Okay, you will read these words again in future. Vasa nervorum. ठीक है, vasa vasorum is also there, vasa nervorum is also there. So vessels within the nerve. Okay, we will read about one nerve, very important one, that is the optic nerve. Okay, there is central artery of retina. Inside that nerve, in the eye region, we will discuss that. So blood vessel is present only in the epineurium and perineurium. That is also very important. only in the epineurium and perineurium. Endoneurium, it does not have blood vessels. Okay, so you can write endoneurium, no blood vessels. Okay, nerve fibers, they receive the nutrition by the diffusion through the endoneurium. Okay, that is the next pattern question, viva question, which is asked. Okay, then showing you this images from histology, although we will take up separately also. So this is the image showing the same, that is the epineurium. Okay, this is the histology section of the peripheral nerve only. Same thing which we have discussed previously. You can see the nerve vesicle. Okay, these are the myelinated axons, as you can see. This is the perineurium. The outside one would be the epineurium. This would be the perineurium. This was the perineurium. Okay, so you can see in this another photo. This is the endoneurium which has been shown. This is the perineurium and this is the epineurium. Okay, so these neuriums are very important, don't miss them. Okay, then you have cranial nerves. So there are 12 pairs of cranial nerves which will be taught to you in quite detail in the head and neck region, so I'm not taking them separately here. Okay, so they are responsible for different kind of sensations and actions in the head and neck region, motor functions also, which you will read. They are designated by Roman numerals 1 to 12. You have to remember them, mug them up. All these names correspond to which number, that is extremely important. And the cranial nerves and their main functions, they are listed in this table. Out of all of them, the trigeminal nerve, which we will read about in detail in the head and neck, it is the largest cranial nerve and the vagus is the longest and trochlear nerve is the smallest. Okay, so you can write the trigeminal nerve, this is the largest, the vagus is the longest, whereas the trochlear is the smallest. Okay, all the cranial nerves, they emerge from the ventral aspect of brainstem except only one, that is trochlear nerve, which emerges from the dorsal aspect of the brainstem. We will study in quite detail in the neuroanatomy, so don't bother. All these spinal nerves, they supply the skin except the first cervical spinal nerve. So then we come on to this image which shows us the typical thoracic spinal nerve. So how many spinal nerves are there? I told you spinal nerves, how many? There are 31 pairs. Okay, of spinal nerve which arise from the spinal cord. So there are 8 in the cervical, that is the C1 to C8. Then you have T12, that is thoracic, 12 pairs. Then you have lumbar 5 pairs. Then you have sacral also 5 pairs and you have coccyx 1. Okay, so these are the 31 pairs of the spinal nerves which you have to remember. Okay, so typical spinal nerve which we will study in detail in the thoracic region. You can see the spinal cord section. Okay, this is the dorsal root and ventral root. This is dorsal root, ventral root. You can see, how did I guess? This is the dorsal root ganglia. The dorsal horn of the spinal cord, this is the H-shaped gray matter. Okay, so this dorsal horn is long and slender as compared to the broad anterior horn. Okay, so this you will study in detail again in neuroanatomy. I'm just sensitizing you to this topic. So the typical spinal nerve, it arises from the spinal cord by 2 roots. One is the anterior root, which is the motor, arises from the anterior horn cells, and then you have the posterior root which arises from the DRG, that is a posterior dorsal root ganglia, which has nerve cell bodies of the sensory nerve fibers. Okay, so that is about the peripheral nerves, although we will discuss quite detail about the peripheral nerves in the separate regions. Okay, then we come on to this photograph. This shows something known as dermatomes. Okay, dermatomes. So what is a dermatome? You should be knowing a definition, although it will be coming again and again to you in your exams. It is the area of skin which is supplied by single spinal nerve. It is supplied by single spinal nerve. Okay, so during the embryonic development in the limbs, the dermatomes, they migrated away from the trunk. So during this migration, they carry their nerves and vessels. Okay, so you can see in this photograph the various dermatomes are there, and in certain places you will also see there is a segmental overlap. So there is a varying degree of overlap between the adjoining dermatomes. Hence, the area of sensory loss in damage to a particular spinal nerve is always less than the area of distribution. That is also very important. Okay. Then you have some plexuses which are formed. Okay. So plexus, like, before I dive in that, there is a plexus. We will talk about them in detail later on. Plexus, that anterior primary rami, if you remember, of the spinal nerve, they join and then split again to form a network of nerves which are known as plexus. Now there are three major plexus in the body. One is the cervical plexus, second is the brachial plexus, third is the lumbosacral plexus. Cervical plexus, it innervates the head and neck. Brachial plexus, it innervates the upper limb. Lumbosacral plexus, it innervates the lower limb. Okay, so that is how you will understand, and the root values are different. We will study them in detail, region to region wise, in the regional anatomy. So nothing to worry. Then you have the reflex action. Now this reflex action, although you study in physiology again, this reflex action is an automatic rapid involuntary response. It's an automatic, rapid and involuntary response to a stimulus without conscious thought. Okay, so this is a fundamental protective mechanism against potentially harmful or dangerous stimuli. So this occurs without the involvement of the brain's conscious processing. So again, in a reflex arc, you have certain components which are very important, and that is what you have to remember. The components. Number one, that is sensory receptor. Number one, that is a sensory receptor. Number two, we have the sensory neuron. Number three, we have the integration center. Number four, we have the motor neurons. Number five, we have the effector organ. Okay, so now see the sensory receptor. The process begins with a sensory receptor always. Okay, so which detects the stimulus. Stimulus can be heat, pain or pressure in the peripheral nervous system. So there is something which has started from here. Now there is a sensory neuron which sends a signal through the sensory neuron. Sensory receptor is sending the signal through the sensory neuron, okay, to the spinal cord. There is integration center in the spinal reflex arc. Sensory neuron synapses with the interneuron. Okay, sensory neuron synapses with the interneuron, and which is also known as association neuron, as you can see in this photograph also, within the spinal cord itself. Then there is a motor neuron. There is a motor neuron which you can see green color fibers which are shown here. Okay, maybe you can see better now. Interneuron, sensory neuron, motor neuron. So the interneuron sends a signal through the motor neuron, also known as effector neuron. away from the integration center. The motor neuron carries a response signal to the effector organ, typically a muscle, as in this case a muscle, or a gland. Effector organ, the motor neuron stimulates the effector organ, which carries out the response as a muscle contraction or releasing the hormone from the gland. There are various examples of such kind of reflexes. So you can see in this list is given to you. This will be taught to you region wise separately. Knee jerk, biceps reflex, withdrawal reflex. Then you have crossed extensor reflex, gag reflex. All these are the reflexes which will taught to you in quite detail in the human lab in physiology. You will perform these. Also you will study them in quite detail in the physiology again. Then lastly you have the autonomic nervous system. Now autonomic nervous system, it regulates the involuntary activities of the body such as the blood pressure, regulation, size of pupil, digestion, peristalsis, secretion of the glands, heart rate and various others. Hence it is also known as visceral nervous system. Okay. Now there are divisions of the autonomic nervous system which can be divided into three categories. Number one, sympathetic. Number two, we have parasympathetic. Number two is parasympathetic. Number three is enteric nervous system. Enteric nervous system is something which is in great research phase in AIIMS, New Delhi. Okay, so you can very well expect so many questions in INI, based on this topic. So see, although you will study everything in quite detail in physiology, I am just giving a brief outlook here. Okay, so sympathetic nervous system, which has also known as thoracolumbar outflow, which you can see T1 to T12, L1, L2 spinal segments. You have a preganglionic fiber, a postganglionic fiber. Okay, this is sympathetic trunk, which you can see. We will discuss this in quite detail in the region wise. Okay, so that's the reason why I am not talking about in detail too much here. Ultimately you have to see the organ, that is the gland or the muscles. Then parasympathetic, that is the craniosacral outflow, again from the brainstem itself. You have certain ganglions which are the parasympathetic ganglions in the head and neck region. Okay, which will be taking the preganglionic fibers, and then after relay the fibers will be postganglionic fibers. Okay, we will study again this in detail there. Okay, then you have lastly, that is the enteric nervous system, which consists of the neurons located in the walls of the intestine. It consists of certain names, if you can see here, mesenteric plexus. Then you have the submucosal plexus. Okay, so it's basically neuronal network, which you can see the nerves here. All right, so Meissner's plexus is there in the submucosa. This is the Meissner's plexus. Okay, Meissner's plexus. Okay, then you have Orbach's plexus or mesenteric plexus, that is also known as Orbach's plexus. Okay, this lies between the outer longitudinal and inner circular muscle mass of the muscle cords of the muscularis externa. Again, we will discuss this in quite detail in the histology. Okay, then you have similarly the differences between the sympathetic versus parasympathetic, which you can revise from here or from your Guyton Ginong as you wish. Okay, then you have similarly differences between the sympathetic effect and the parasympathetic effect, which you can revise. Last but not the least, that is the clinical integration, which is my favorite part. I told you that is something known as visceral pain. Again, we will be discussing this in quite detail, region to region wise. So the autonomic nerves, they carry the visceral pain sensation. It is poorly dull localized sensation, and it is usually referred to the skin, that is the dermatome, which is innervated by the same spinal segment. Okay, so what is the anatomical basis? So through the spinal cord, the visceral pain sensation, they reach the area of sensory cerebral cortex, which represents the specific skin area, that is the dermatome. Hence the visceral origin of the pain, it cannot be differentiated at the consciousness level. Okay, the sites of the referred pain are shown in this image. Heart, referred pain of heart, it is to the left precordium, inner aspect of the arm, forearm. Okay, as you can see highlighted also in this photo. Gallbladder, the referred pain of gallbladder is at the tip of the right shoulder. Spleen, tip of the left shoulder. Diaphragm, tip of the corresponding shoulders. Okay, then appendix, testis, ovary, around the skin around the umbilicus. Okay, so that is T10 dermatome level. That is also a recent MCQ question only in the competitive exams. So that's about the visceral pain, referred pain, which we will discuss in quite detail region to region when we will discuss the abdomen specifically and thorax. Okay, so referred pain concept we will take there separately. Okay, all right, so thank you so much. I hope you have understood this topic well. Do keep revising, don't miss it, and also please remember to follow me on Instagram channel. My Instagram handle is dr.nikhil.md.kgmu. So please remember to follow me on Instagram to stay connected for a very longer duration of time. Thank you.